Hi, I'm Dr. Anirudh from Toothpicks Dental Healthcare, and in today's video, I'm going to talk to you about how to keep your toothbrush clean. First point is that you will never share your toothbrush with anybody. That is yuck. You're not going to share your toothbrush with anybody, whoever it is, whoever you're close to, you're not going to share your toothbrush. All right. Second point is that you, before using the toothbrush, run it in a hot flowing water so that the debris, the dust, or any kind of accumulation of toothpaste or anything that is there in the brush gets cleaned off. Then apply toothpaste and start brushing your teeth, finish your brushing technique, and then you're going to do the same procedure of cleaning the toothbrush and make sure all the surfaces of the toothbrush is clean and it has to be kept dry. You can use a tissue to dry the bristles. Just dab it, dry the bristles, and allow it to air dry vertically so that the water will drip off and the air around the toothbrush is going to keep it dry. Never keep it in a wet atmosphere, because in wet atmosphere there's a high chance that the bacteria can accumulate and increase in number, and your brush is going to be infested by bacteria. So the other technique to disinfect your toothbrush is using chlorhexidine solution. A chlorhexidine solution is used, and then you're going to dip your toothbrush into that and leave it for 15 to 20 minutes. Now, after you finish doing that, you're going to discard this solution. You're not going to reuse it for another toothbrush, or you're not going to use it for your own toothbrush again for the next time. So you're going to discard this solution. If you don't have this solution, then you can use hydrogen peroxide 3% for the same procedure. Keep it for 15 to 20 minutes, remove it, wash it, rinse it, keep the bristles dry, and save the brush in a very safe atmosphere where it cannot catch bacteria or wet atmosphere. If you have any kind of flu, cold, cough, or you have phlegm, you have pharyngitis, you have throat related problem, oral related problem, you have fever, anything of this sort, it's time to change your brush, because after you have this kind of an infection, I don't recommend that you use the same toothbrush again. You have to discard your toothbrush. The other reason why you need to discard the toothbrush is when they flare, when they change their shape and they're not acting effectively on your teeth. Generally, 3 to 4 months you can use a brush and then discard it. But however, whenever you go to your dentist, take your brush along with you, so the dentist will be able to tell you what is going wrong in your brushing technique, or if your brushing technique is good, then probably he's going to tell you to continue using the same thing. I hope you'll all maintain your toothbrush really well. It's the basic thing that we use every day, and let's keep the brushes as clean as possible, because our mouth and our oral hygiene is going to be wonderful if we have a wonderful brush which is healthy. Thank you so much.